to, but if you prefer not to be on camera, then do switch it off. And if you could just remember to mute yourselves during the presentations so that our speakers aren't disrupted during their presentations. Okay, so that's us being recorded now, Isla?
It is, yes.
Great. Okie dokie. So good morning, everyone, again. My name is Susan McVie. I'm based at the University of Edinburgh. I am the lead for the data analytics and AI theme of the Scottish Policing Academic Centre of Excellence, or SPACE. SPACE is one of 9 funded policing academic centres of excellence that exist across the UK. We're funded by the UKRI, and SPACE works very closely with Police Scotland to support innovation and improving safety and prevention of crime and harm by developing world-leading evidence-based solutions to modern policing challenges. This event that we're running this morning brings together 2 fabulous speakers. I'm really excited about this presentation. The first speaker is Professor Jane Hutton, who's Professor of Statistics at the University of Warwick. I'm just getting a little bit of feedback, so if people could just double check that they're muted, that would be really, really helpful. Jane works in the field of interdisciplinary statistics and has worked across a range of health-related areas. She also works at the interface between statistics and law and has provided many expert witness reports for court proceedings internationally, and has collaborated on developing educational materials for legal professionals. Jane's won numerous prizes and awards for her work, including most recently the 2023 Royal Statistical Society's Mardia Prize, which has enabled her to fund a series of interdisciplinary workshops on statistics and the law and address questions statistical questions raised by legal processes. The second speaker this morning is Dr. Amy Wilson. Amy is a lecturer in industrial mathematics at the University of Edinburgh. She's also chair of the Statistics and Law section at the Royal Statistical Society. No doubt, I'm sure this spans partly from her PhD, which focused on statistical modelling of cocaine on banknotes, which has influenced guidance and practice in the routine testing of notes in forensic laboratories worldwide. Amy is also a co-organiser of the Statistics and Law Probabilistic Modelling of Forensic Evidence research project, which is part of the Alan Turing Institute's work. This project involves ensuring that technological and scientific advances in forensic science are supported by well-developed tools for analysing, evaluating and interpreting evidence so as to maintain fairness and impartiality in the administration of justice. Amy's also an award winner of the 2022 Edinburgh Mathematical Society Impact Prize. So I'm sure you'll agree that both of our speakers are well placed to give this morning's presentation, which is going to focus on statistical issues in police investigations, including clusters of healthcare deaths. The presentations will start with Jade, who will talk about clusters of healthcare deaths using the Lucy Letby investigation as a case study. This work draws on recommendations of a report published in September 2022 by the Statistics and Law section of the Royal Statistical Society. And then Amy will talk more specifically about the uses of statistics in policing investigations and identify some of the key challenges in that work. She'll talk about some of the work undertaken by the Statistics and Law section of the Royal Statistical Society to support legal professionals and develop guidance with the National Police Chiefs Council. Both Jane and Amy will speak for around about 30 minutes each, which will leave us about half an hour for questions at the end. If you could please just post any questions into the chat function as we go along, and I'll facilitate the responses after both of the speakers have presented. Okay, so Jane, if you'd like to share your presentation and kick us off.
Thank you very much. Right, I can't actually see what that looks like. Do I need to make it full screen or is it full screen already?
If you could make it full screen, I think we can see it quite clearly, but it's not taking up the full space, so to speak.
Okay,
There, that's perfect, Jane.
right. Okay, so it does mean I can't see anybody, and that webinars are wonderful in terms of being able to be more accessible, but it does leave one feeling like you're talking to the ether, which I suppose you are. So what I want to do is to make some general points about the potential for collaboration between statisticians, the police, and others. And this is very much in the spirit of collaboration. I have a very being persuaded not to do something that probably cost about £2 million and a lot of angst. So I will be critical of some things, but it's with a view to improving our joint work. So I'm going to start with some clusters that you might have come across, and then I'm going to talk about epidemiology, because there's seems to me to be perhaps less cooperation between the Home Office and the Department of Health than might be useful. I'm then going to talk about a success story from Merseyside in finding the answer to a question of why a sudden unexpected cluster had appeared. And then I want to talk about the report which the RSS wrote in terms of sorry, I should have put a timer on sooner. In terms of issues about investigating multiple deaths, serial killers, what is and isn't a coincidence? How do we decide? And then end with some comment on the progress that's happened since, I suppose, a combination of the Mardia workshops and the collaborations that have come out of that. I thought I'd start with a Scottish case that I did happen to be involved in. This was Glasgow area, and there was an outbreak of E. coli. And basically what happens when you've got an outbreak, something like this, it goes to Public Health or Health Protection Scotland, or whatever the current name of that group of people are. And interesting enough, those people are actually on call. One of our neighbours was going to do something with us on a Saturday, and first thing in the morning, we got a message saying, there's been an incident, I can't come. That was actually the ship with the hantavirus. So you do actually get on-call people. So if you think it's serious, you can get an immediate response. Let's think of three more cluster examples. So a fairly old one arose from a BBC, no, an ITV documentary, not sure actually which. They reported 7 childhood leukemia cases between 55 and 83 in C-scale, which might not mean anything to many of you, but C-scale was in fact is now called Sellafield. So it's one of the nuclear plants. And that's a long-running story. I mean, even in 2017, there's sort of still discussion about what was happening, how you decide on it. The second example was 1993, so a bit more than 30 years ago. You had 5 boys with cystic fibrosis brought to the Children's Hospital with severe stomach problems requiring surgery. And then my third set of clusters was the pattern of deaths in the neonatal unit at the Countess of Chester Hospital. So you're having 4 or 3 deaths over a series of years, and then you get an increase in deaths, and you have to say, what do we do now? Whether it's childhood leukemia, urgent surgery, deaths in a neonatal unit. Oops, sorry, I pressed the wrong thing. Just trying to press page down. So why would the Health Protection Agency be involved? Well, that's the meat and drink of a lot of their work. There are established methods for investigating clusters and causes. The textbooks are written getting on for 50 years ago. And the Health Protection Agency has guidance for how to investigate and manage outbreaks or incidents of something unusual. That was 2010. And the Department for Health and Healthcare Health Quality Improvement provided, and they've kept updating it, a booklet on detection and management of outliers in routine audit of hospitals and other providers. So if you're routinely going along recording the number of deaths on a ward and the numbers go up, there is guidance. And pretty well the first thing it says is the statistical analysis involved should be carried out by people with appropriate statistical expertise and experience. I think Amy will mention the work we're trying to do to make sure that such people are easy to find and engage. Public Health England produced a modified version for non-infectious disease clusters from potential environmental causes. And I know most people might think environmental means rain or wind or radon, but actually it simply means we can't say it's a bacteria or a virus, something like that. It means something that's not going to be spread by some little beastie. There are quite a lot of different types of study used in healthcare, which, as Susan said, is where I have spent a lot of my working time. What's critical is you must have accurate definitions and diagnostic criteria. That can be quite an issue. If you're going to say that somebody has, for example, autism, you do want to be clear what that means. What tends to happen is the definitions drift into common speech and you get comments like, oh, they're on the spectrum, without any kind of rigorous diagnosis. You might just be saying, I'm not really keen on mathematicians because they're very blunt and they think they can get things right and wrong, as opposed to us nice people who always say, oh, I'm not sure about that. I don't feel right. Okay, so one of the most important things you will do, and it's a standard tool if you're trying to rapidly find out what's going wrong, is a case control study. And it's one of the types of observational studies. And you can think of it as a retrospective experiment where you're trying to get hold of your cases with the disease or condition under study. So with HIV, you suddenly get an outbreak of a very rare cancer. You thinking, why did this happen? You get your cancer cases. And then you want to get controls. And what you're trying to do is to say, why have these people suddenly got cancer when these other people haven't? And you want your controls to be very similar, but obviously without that particular disease or condition. So you've got to find your controls, you've got to define your controls. Then you need to collect data on medical and lifestyle histories. Sometimes that's easy if you're doing it within an occupational setting. Why have you got an increase in risk of lung cancer in people working in mines? Sometimes it's very difficult because you've just got the general population, and if young men haven't seen their GP for the last 5 or 10 years, not much information. You get the data that you can, you compare to find what factors are associated with a disease or condition of interest. So the advantage is it's relatively quick and cheap. You're using existing data, you're looking backwards. The disadvantage is you've got to rely on information which has already been collected. We know with cancer that when people get a cancer diagnosis, they start thinking very carefully about past exposures, whereas people who haven't got cancer don't. That resulted actually in a study which suggested that mobile phones protected you from getting brain tumors, provided you only use them a little bit. Complex cases are always going to require multidisciplinary collaboration because if it's children, you're going to need the pediatric physicians, the surgeons, pathologists, pharmacologists, statisticians, and so on, because there'll be all sorts of different angles, and it's impossible nowadays for anybody to be on top of all the different possible angles. So I'm going to start with a cluster that's quite simple and a success story. Cystic fibrosis is an inherited condition. So basically you're born with very sticky mucus that builds up in your lung and your guts. So think of the worst chest infection you've had and think of living permanently like that with thick phlegm, coughing, and so on. So the children and adults have to be treated. And what happened was that in 2 months, so between July and September 1993, 5 boys with CF presented as emergencies at Alder Hey Children's Hospital in Liverpool. They were all diagnosed with intestinal obstruction or colonic stricture, if you prefer. In other words, their guts were blocked. And so they had to have surgery. But the doctors had never seen anything like this before, a bit like the outbreak of Kaposi sarcoma at the beginning of AIDS. So in October, Ros Smith, the paediatrician, consulted Dr. Deborah Ashfish, who then was, who was a statistician and epidemiologist. Why was that her first response? Well, I mentioned that advice from the Health Quality Improvement Group, go and find a statistician who knows what's going on, who can help you find out what is going on. So within 4 months, there was an article published in The Lancet talking about what had happened so that they could alert the medical profession. And obviously when something happens, you say, why? You know, what causes, where do we start looking into emergency surgery or unusual cancers? And the doctors at Alder Hey had said the only thing they could think of with these children was the use of high-strength medication. So children with CF have to take, okay, this is back 30 years ago, had to take something like 6 tablets 4 times a day. And most people, adults, don't like taking tablets. And a lot of children are very unhappy. So quite sensibly, there was an attempt to reduce the number of tablets they had to take by making a single higher strength tablet. Well, because that was a possible cause, the UK Committee of Safety of Medicine was able to change patients back to standard preparations. You initiated studies. So there was a list of physicians with CF patients. Was there any surgery or biopsy of the gut after 1 week? A yes response meant you got pathology reports and gut sections, and they were reviewed independently by an expert pathology panel of 3. So 2 people reviewed them. If they agreed, fine. If they didn't agree, a 3rd person came in, and there was a diagnosis. Okay, no, I don't understand all those words. The point is, you need a multidisciplinary team. It's up to the pathologists and doctors to know what those words mean. That's not the role of the statistician. They got 4 CF controls per case, and they matched on age, but not sex. You usually match on sex. You didn't in this case. Why not? Well, your first 5 cases were boys, but both boys and girls have CF. And so that was another flag. Do we need to check whether this might be sex specific? Well, by 1995, the answer had been published in The Lancet. That had involved reviewing the UK CF population from 84 to 94. 14 cases were found only from April 1993. So you're going to go, okay, why a sudden change? It was confirmed 12 of the 14 were boys, so you know boys are more at risk. And then when you do the statistics, yes, you find the risk is the high-strength medicine, and the longer you've been on that medicine and the higher the dose, the higher your risk. It was also the case that 6 children had some care in Liverpool. We knew about 5 already, of course. And care at Liverpool was associated with a doubling in risk. But once you allow for the fact that Liverpool is a very advanced centre and had started using the new medicine early on, there was no significant difference. So just having mentioned that success story, so that's 2 years from start to finish, which is pretty quick. Let's go back to Sally Clark, case Angela Canning's Tripti Patel from the last century, because it's a case that's known to many people. 2 children died, unexplained deaths. She was put on trial to see if she was guilty of murder. We'll call that G. So innocent is G complement. And an expert said the probability of this evidence, if she were innocent, was 1 in 73 million, or winning the Grand National or something. Unfortunately, people tend to hear that as this is the probability that she's innocent, given that there are 2 deaths, the evidence. And the expert was a retired paediatrician. Sally Clark was jailed for life. Angela Cannings was jailed for murder of 2 of her 3 children, similar story, and both convictions were later overturned. And the House of Commons produced a report, and the appeal court acknowledged that the misleading impact of the statistical evidence in the first trial, even though the judge told the jury to disregard it, would have been sufficient ground for declaring the conviction unsafe. And they commented that the lawyers and judges involved, who may have been able to prevent the miscarriage of justice, the human cost and damage to public confidence in the criminal justice system associated with flawed expert evidence. So the legal profession was told to take account of this and be more careful. What is the critical point? Critical point is you've got to frame the question correctly. The forensic science regulator requires you to say, given 2 deaths, what's the most likely explanation? Not the other way round, and that's called transposing the conditional. You might remember this chart where you're trying to create an impression of a coincidence. What's the chance? And after the Court of Appeal judgment in the Lucy Letby case, after she'd been convicted of 7 murders, harm of others, babies, there was a big outcry. And I rather like the comment from the Financial Times. The current cluster of expert concern is too great to be a coincidence. So I'm not saying that the conviction is unsafe. The Criminal Cases Review Commission needs to look at the evidence, preferably slightly faster than they did with Andrew Wilkinson. But when the news of this came out, the Statistics and Law section decided to write a report and provide some recommendations. First recommendation is the same as the Department of Health. Get qualified statisticians involved and only use appropriately qualified individuals as expert witnesses. That's consistent with the House of Commons report. And DSI Hughes said, yes, we must do everything by the book. But which book? And the correct book is Epidemiology and Statistics. Because if you're investigating unexpected events, the first question is, who wasn't expecting them? How unexpected are collapses or deaths in both or all of seriously ill premature twins and triplets? What we expect depends on our knowledge. And you've also got to estimate the effect size and p-value properly. The initial approach to me was, can we assess sheer coincidence being on duty during all the deaths of collapses in the neonatal unit, 1 in a million? That's the wrong question. The question is, if there are clusters of deaths, which is the most likely of all possible explanations? If you've already got a report listing 23 major failings in a neonatal intensive care unit, neonatal unit, you need to think about all those possible causes: infection, doctors not being present, not sufficient staff. And that's what the forensic science regulator's guidance expects. Evaluation is only meaningful when 2 competing, mutually exclusive propositions are considered. Emergency cesareans, prematurity, triplets, and you must avoid treating p-values or coincidence or chance as a probability of innocence of guilt. Now, the entire exercise for Lucy Letby avoided specific p-values. But that chart, the question was, what's the chance of that? That's a probabilistic question. The prosecuting barrister emphasized the coincidence of problems and said it must be her malign hand at work. But we have to think, what about the deaths when Letby was not at work? What is an unexpected collapse? And the judge quite specifically was about probabilities, the unlikelihood of coincidence. And are we wrong? Quite a number of people, particular barrister and very senior judges trying to stop the RSS, claimed there was no statistics, that on the basis that there wasn't a p-value and they could recognize a pattern. What is statistics? Statistics is not a p-value. And this is a paragraph I use in my expert witness reports to emphasize that statistics includes the design and evaluation of data collection methods, the initial examination of data to assess quality, bias, distribution, clear statements of the assumptions made in the choice and implementation of statistical models, consideration of how the models might be affected by biased data and implausible assumptions, and presenting the results with appropriate measures of uncertainty. If you saw identical triplets, would you immediately think there was a crime? Well, apparently the three judges in the Court of Appeal do. They said the prosecution relied on the fact that siblings suffered harm at or about the same time as each other. But there were many problems. And why wasn't there any expertise? I might be a statistician, but I've published 25 papers in pediatric epidemiology, rather more than certain Dr. Dewey Evans. Babies E and F were monochorionic twins. They shared a placenta. OP and R were monochorionic triplets, right? They are very high risk even before they're born. And in fact, there's a study published that shows that a quarter of those pregnancies will have the death of one or more infant. Those are the completely unproblematic pregnancies. It's much more typical to have death rates nearer 80%. So that's very common. It's only unexpected if your obstetricians haven't bothered to do their homework and don't know what a monochorionic triplet pregnancy is and the risks associated. You need all relevant areas of expertise. Because Letby had never been seen to do any harm, the prosecution based their case on a claim that she must have used external insulin, even when she wasn't present on the ward, of course, because of the levels and the ratio. Well, if you look at laboratory measurements, they can be very expensive. So it's routine to have a cheap measurement. And then if there's a problem, you do the proper measurement. So basically, all you have to do is get within 25% of a trimmed average of all laboratories. So I'm, say, 160 centimeters rounding. I weigh 64 kilograms, body mass index 25. What happens if we apply that plus or minus 25% standard? Well, my height could be anywhere between 1.2 meters and 2 meters, my weight 48 to 80 kilograms, and my expected body mass index 12 kilograms per meter squared to 56. Well, in the Operation Hummingbird video, there was a comment, you often have something visual for a jury. So here's a visual. Please note, the assay is not suitable for the investigation. Please inform the laboratory. Well, the doctors didn't inform the laboratory. Let's have another visual for the jury. Apparently, nobody was concerned about the idea that you couldn't tell the difference between these three people. And notice that that's not the full extent of the variation allowed by the laboratory standards. If you'd been told that a short, fat woman had hit somebody over the head, would you be happy if the person in the dock was a very tall, very thin woman? The other thing that's really important is unconscious bias. We are all biased. We are not accusing anybody else. We're saying we are all biased. But Evans used notes with names. He changed at least 10 unexpected events to become expected when he found who was on the shift. And he's changed his mind about the cause of death for 3 babies after the trial. And his report wasn't independently assessed. It was peer reviewed. The consultant said in Thirlwell that we didn't think baby H was suspicious. Then we checked and Letby was on duty. In other words, the common factor was Letby. There's no evidence of anything else. And the police, you read something and you think, gosh, she really has done this. I could never say that in a randomized controlled trial. I was analysing, gosh, this treatment works, because I do not know which treatment is which. That's essential. What about alternative explanations? DSI Paul Hughes said Letby had been moved off the ward, the deaths and collapses had stopped. He forgot to mention that the unit was downgraded to level 1. It wasn't accepting seriously ill babies. And then he said, we know other people weren't present. He didn't mention the other people who weren't there, the medical consultants who were failing to do ward rounds twice a day, the fact there were no longer any advanced nurse practitioners. What about alternative explanations? That visual chart only showed nurses. It didn't show that some babies appeared 2 or 3 times. There are twins or triplets, no adjustment for length of shifts, available staff, prematurity, severity, and the jury didn't hear about the critical reports. The judge excluded those reports. You're supposed to consult independent statisticians and psychologists with relevant experience. That's established by the forensic science regulator in the guidance on cognitive bias. And yet, the Crown Prosecution Service didn't want to look at the validity of the statistical evidence in the case. The instruction contravened, the instruction not to pursue the line of inquiry, contravenes the Criminal Proceedings and Investigations Act in 1996, and the England and Wales Crown Prosecution Service, I don't know about Scotland, I haven't looked it up, has a code of conduct which states prosecutors cannot direct the police. But there is good news. And the final point was the educational interactions between legal and statistical community should be increased. We should be fostering joint educational activities, and that is happening. RSS Stats and the Law is working with the Forensic Science Regulator, the Law Commission, NTA, NPCC, Faculty of Advocates. I've had a student do a master's project with the City of London Police, which they wish to have published as an academic paper. And of course, thank you for attending, because today's seminar is also part of our effort to collaborate with police and legal professionals to improve both healthcare and justice in this country. Thank you.
Thank you very much, Jane. As I said earlier, we'll take questions at the end, so I'll just ask Amy to prepare her slides. There were a couple of comments in the chat as you were speaking, Jane, but I think they mainly related to maybe a typo in one of your slides about the transposing the conditional with P probability of G to A and G to A, which maybe should have been G to A and A to G. But I'll let you have a look at the chat, and if that's something you want to discuss, you can raise that later. So Amy, over to you.
Great, thanks. Can you hear me?
Yes, can hear you perfectly.
Excellent. So yes, thank you very much for having me speak today, and thank you for the introduction. I've just put my email on this slide here, and I'm happy to take comments, suggestions, questions, or anything else via email if anyone wants to get in touch. So yeah, I'm a lecturer in the School of Mathematics at the University of Edinburgh, and I'm also the chair of the Royal Statistical Society Statistics and the Law section. And a lot of the things that I'm going to talk about, especially at the end of my presentation, are sort of joint activities coming out of this section. So, oh, can I change the slide? There we go. So I'm going to start off by sort of trying to illustrate some of the points which Jane has made very well already about statistics not being particularly intuitive. So I've got two patterns on this slide, pattern A and pattern B. And one of them is random, meaning that any pair of coordinates is equally likely to be picked, and one of them isn't. And the question is, which is which? And I don't think the answer is particularly obvious. The answer of which is random is actually pattern A, even though on sight it actually looks a bit more like that one's got some sort of patterns in it. Pattern B has some structure. So the point here is it's not easy even for a statistician to tell these apart. So intuition is not necessarily going to give us the right answer. And another question, so would there's about 100 people on this call, I think. Would you consider it a coincidence if 2 people on this call had the same birthday, day and month? Probably not. There's quite a lot of people on this call, so probably at least 2 people are going to have the same birthday. What about 2 people at a party of 50? Maybe that question is a little bit harder. Is that a coincidence or not? What about a party of 10 people? Okay, maybe at that point we're starting to think it would be a bit of a coincidence. But actually, this is a sort of classic example that these probabilities are a lot higher than you might think. So here's a plot here. We've got number of people at the party along the bottom, and up the side is the probability of at least 2 sharing a birthday. And by the time you get to about 50, you're pretty near 100% chance that 2 people are going to share a birthday. And even down at 10, you're up at close to 20%. So actually, it's not that unlikely at all. You wouldn't really describe that as a coincidence. But even me as a statistician, I wouldn't like to answer these questions here without actually sitting down and writing down the equations and working out what the probabilities are. And that's kind of the point here, is that if you're presented with something that appears surprising like this, you do need to kind of sit down and speak to a statistician and work out if it is really surprising. So what I'm going to talk about in my time today, I'm going to start off by discussing, which Jane's already done a pretty good job of already, what statistics is and why it's important in policing. And then I'm going to go through a brief summary of some key statistical challenges in policing. And I just want to say that this is non-exhaustive because there's a lot. So I've only covered a subset of some of the issues that I can see. And then I'm going to finish off by talking about how we can work together, including some of the initiatives that are currently ongoing with the Royal Statistical Society. So what is statistics and why is it important in policing? I almost don't need to go through these slides anymore, but for me, statistics is the science of reasoning under uncertainty. And that includes, as Jane said, everything, all the way from collecting the data, analysing the data and interpreting the data. And we need to do all those things to reason under uncertainty. And I interpret data broadly. So statistics isn't just about numbers, about p-values. Data can be any information. It might be documents, it might be events, any information that we're trying to take inference from. So statistics is a science of reasoning under uncertainty, and everyone reasons under uncertainty all the time, right? So every day we're all taking assessments about whether it's safe to cross the road. We might be taking decisions about whether we want to invest in a shares ISA or a cash ISA. We might be thinking about medical procedures and weighing up risks and benefits for a vaccination, for example. And all of these are examples of reasoning under uncertainty. And what statistics does is it provides a scientific framework to support that reasoning. And just to reiterate, that's all the way from collecting the data, analysing the data and interpreting it. And although we might not want to do a statistical study for all 3 of those questions, in general, statistics is not intuitive, as I hope you saw from those examples at the start of my presentation. And humans can and do make mistakes if not following formal frameworks. So this is sort of reiterating Jane's point that we should really be using qualified statisticians to avoid common fallacies. So what's this got to do with policing? So in policing, investigators draw inference about what might have happened or what probably happened when deciding how to follow up lines of inquiry. And when you're doing this, when you're making decisions about what you want to do, you necessarily have to take judgments about the likelihood of different events, right? And if those judgments that you're making are not statistically sound, then you can make bad decisions, leading to waste of time, waste of money, and in the worst case, leading to potentially biases in the investigation because you're moving towards lines of inquiry that are not statistically supported, which can potentially result in misleading evidence later on in the legal process. But investigators also collect information and evidence. So even if they're not trying to draw inference from that information and evidence, they're still doing statistics in some sense because they're collecting information or evidence, which is then later on going to be used to support others to draw inference, for example, in the CPS or in the courtroom. And if that information and evidence is not collected in a way that's going to validly support the inference and the decisions later on in the process, again, this can lead to flawed and misleading conclusions. So I'm just going to run through some examples of some previous cases where statistical issues have come up. And these are, I'm only going to talk about them very briefly. They're very high profile cases. There's lots of others, and these are only the ones that we hear about in the news. So I'm sure there's many others that we don't hear about. So the first one Jane's already mentioned. This is sort of the statistician's favourite example, the Sally Clark case. So Clark was convicted of murdering her 2 sons, partly on the basis of a miscalculated and misinterpreted probability, which Jane already explains, the 1 in 73 million, and her conviction was overturned. It was overturned on the basis of different evidence, the toxicological evidence, but the appeal court stated the importance of the presentation of the statistics in that case. That's Sally Clark. Here we've got Lucia de Burke. This was a Dutch nurse who was convicted of murdering her patients. And the statistics in this one was really a lot more complicated. There were multiple statistical failures here. So the data that were collected by the investigators were biased because and by data here, I mean the incidents, the events, the deaths at the hospital, because they were collected focusing on ones at which Lucia had been present. So the data collection was flawed. The statistical analysis of the data was flawed because it didn't take into account all relevant possible factors. And then, just like in the Clark case, the probability that came out in the end was then misinterpreted. So even if it had been right, that was still problematic. And we've got another nurse, Daniela, I can never pronounce her surname, Poggiali, I think. This was an Italian nurse who was convicted of murdering 2 patients. And as for Lucia de Burke, there were multiple statistical failures again. So use of a non-representative data set, again, didn't account for all relevant possible factors in the statistical analysis, and probabilities being misinterpreted at the end. And for both Clark and Poggiali, the statistical analysis was done by a medical expert witness. And there's others, so I've listed some others here. I won't go through them in any detail, except I'll just mention Dion Christie, which is quite a recent case. I think it was last year. So this was a Scottish case in which an ergonomic expert calculated a probability from a simulation model, which was describing sort of the movements of Dion Christie as she stabbed her partner. I'm just going to read out what was said. It was said the probability that Ms. Christie's account can be supported by the biomechanical evidence is much less than 0.25%. So firstly, if you're kind of trying to model people's movements, there's obviously going to be an awful lot of uncertainty in that, and that wasn't presented, that uncertainty in that percent. And also, you know, what on earth does that percentage mean? It's really not clear. It's being presented in a way where it's not clear what it means, and it's not clear how it should be interpreted. And the court picked that up and they scrapped that evidence on appeal. Christie was still found guilty, but I think that's an example of where the court did pick up, in this case, some poorly presented statistics. Okay, so that's some previous cases. So what should we take from this? So I've put big klaxon on this slide. So I think where we're hearing words around that are associated with statistics and probability as part of a criminal case, I would like to think that these particular words might be triggers for when you might want to call a statistician in for support to figure out what's going on. So the words I've listed: likelihood, probability, risk, and chance. Rare, unlikely, coincidence, what's the chances of that? Anything about clusters? Anything about significant or material changes? If these things are being discussed as part of a criminal case, then some inference is being drawn from some data somewhere. So the question is that inference sound? And is a statistician needed to support what's trying to be presented here? Because as I've shown you, sometimes intuition on these concepts can be very wrong. And so many of these words also have meaning in common language as well, which is where things can get quite tricky. Okay, so that's kind of a brief introduction about statistics and policing. I'm now going to just run through some specific statistical challenges that can arise. And as I said before, this is not exhaustive. There's many other things that I could have discussed here. So The first one, which came up across all those previous cases that I mentioned, is the idea of a rare event. And was it a rare event? And this is quite a common question. Could this have arisen by chance, or is it suspicious? But the problem is that rare events, coincidences, and clusters do actually happen. So an example of that is a lottery win. So if you pick a single individual, it's unlikely that that individual is going to win the lottery, but it's not surprising that someone wins the lottery every week. So if you, as the police, suspected an individual of fraud and started following them, and then they won the lottery, that might be considered quite unusual and possibly evidence. But we don't sort of go over to lottery winners and start accusing them of fraud. So there's a sort of different context there in which that idea of a rare event is being interpreted. And another example around clusters, and this is taken from the Royal Society primer on statistics and legal proceedings. So when 3 major plane crashes occurred within an 8-day period in 2014, many thought it was beyond coincidence, but there's actually around a 60% probability that a cluster like that will happen at some point in a 10-year period. So that's another example of where something might appear unlikely, but actually the fact that it's happened is not that unusual. But conversely, we have the Harold Shipman case. And this was an example where there were patterns in the data, which was sufficiently unusual to mean that further investigation was needed. So where do we draw the line? We've got different examples here, some of which we would consider rare enough or unusual enough to warrant further investigation, and some which we might not. And it's quite difficult to decide how to deal with these situations. And that's where the sort of expertise of the statistician comes in. But even if we do decide that something is rare, so what? And this was the point that Jane was making earlier about comparing multiple explanations. So back to the Clark case, as Jane said, there was a medical expert, Dr. Roy Meadow. He said, 1 sudden infant death in a family is tragedy, 2 is suspicious, and 3 is murder unless proven otherwise. And he gave this probability of 1 in 73 million. And the number itself was discredited. Because it didn't account for dependence between deaths. But what if it was 1 in 73 million? Right? And as Jane said, this isn't the probability of Clark's innocence. It's the probability of 2 SIDS deaths within one family. So how do we make sense of that? We need to compare it to the probability of the mother murdering her 2 infants, which is also very small. So there's a question about deciding if something is rare, and then deciding, if it is rare, what does that even mean in the context of our case? And these can be challenging questions. And this issue of mixing up the probability of evidence given innocence with the probability of innocence given evidence is called prosecutor's fallacy. And often, so this challenge around interpreting a rare event, hopefully I've shown that with those examples I've given, it's very difficult to do. And whether a rare event is meaningful or not, it is usually very, very context specific. It's very dependent on the case circumstances. And so all these sort of external factors need to be taken into account when these rare events are being considered. And statisticians are trained to ask the right questions, to establish what data should be collected, and do the analysis to provide valid answers. And it can be very, very dangerous to assume things are rare or unusual without doing this process. So following on from that, so my first point was about rare events. I've got this idea that I've mentioned already, that probabilities are always going to be dependent on context. And this context needs to be really, really clear if we're not going to misinterpret things, because innocent factors can cause seemingly unusual effects. So I've got an example here, which is a little bit contrived, but I think it illustrates the points. So if we imagine a perpetrator is known to have a particularly unusual tattoo, because they've been spotted on CCTV, say, and then we find a suspect with the same tattoo, we might think that this suspect is the perpetrator, right? Because they've got this unusual tattoo. But how might we analyze this? Has anyone, first of all, is it an unusual tattoo? So can we go away and calculate whether it is unusual or not? And even if it is unusual, does that make it unlikely they're not the same individual? And that will depend on the circumstances of the case and the context of the case. Because what if the crime scene is next to a tattoo convention? Then you're going to be much more likely to have someone with the same tattoo milling around. What if there's other evidence that suggests the suspect is not the perpetrator? How can the tattoo be balanced off against that? How unusual does the tattoo need to be to convince us that the suspect is the perpetrator, given the context of everything else? And this is, it seems like a simple situation, but it's actually quite complicated. We need to bring in all the information in the case, and we need to be able to understand how everything links together. And here's a real example, and thanks to Julia Mortera for this plot. So this is the recorded hour of death for patients in the hospital at which Daniela Poggiali worked. So just a reminder, this is the Italian nurse who was convicted of murdering 2 of her patients. So we've got hour along the bottom and frequency along the top, and this is recorded hour of death. And what we see here is we've got this big spike at midnight and at 7 o'clock in the morning. And what it turned out was happening is that deaths were being recorded at a different time to when they were being observed. So on first sight, it seems that Daniela was associated with these deaths, but that was only because she was there at the handover when they're being recorded, and not necessarily because she was there at the time that they actually died. So this is an example of where we need to understand the context. What do those numbers mean? And dive a bit more into the detail to understand whether the seeming association between her and the deaths was actually real. And there were similar issues in the Lucia de Bert case as well, in that there were other possible factors that could explain the deaths. Oh. So rare events, getting the context right. And now I'm going to talk a little bit about data sets. So here's an example from a book, a 1961 book by Reichman. It's a study which reports, as the headline, women, 1 out of every 2 gets backache. And this is based on a data set showing that 50 out of 100 women visiting a particular doctor said they had backache. So as a statistician, if I see this, there's an awful lot of questions that I would want to ask to figure out whether this is a reasonable conclusion to draw from that study. Because the important thing is that we need to make sure that the data that are being used to answer questions are relevant. So, for example, what if this doctor is a backache doctor? Then it's completely biased to only look at people going to him. What if the doctor's in a particular area and those women happen to be more likely to have backache? Are these women a representative sample? All sorts of questions like this. And so we need to make sure that any data that are being used to answer questions are relevant. Back to Daniela Poggiali, in that case, data for young adults was being used to answer questions about elderly patients. So we've got an example of where the data set wasn't necessarily relevant. And here's another example on drug traces on banknotes. This is what I did my PhD on. So drug traces on banknotes can be used as evidence of drug dealing. So the implication there is that they're saying that if there's more drug on the banknotes, then the person is more likely to be a drug dealer. And there was a court case in 2015 at which this evidence was criticised, as the forensic scientists doing the analysis, they had a data set. So they took a set of banknotes from a crime and they compared them to their background data set of notes from general circulation. And they were criticised because this data set of banknotes from general circulation consisted only of notes from Bristol banks. And so the court asked, well, is this representative? And I think they were quite right to answer the question. And ultimately, it turned out the answer was yes, it was representative. So Colin Aitken, my supervisor, and I did a study, and we were able to show that, in fact, there wasn't variation around the country in the level of drug on general circulation banknotes. So as statisticians, we were able to add value there because we were able to show that if we did a proper study and we checked and we got enough data and everything else, we can show that actually, even though on first sight this data set might seem not very good, actually it was good enough to answer the questions that were being asked. And then, so that's relevance of data. If we're using a data set to answer a question, it needs to be relevant to the question. There's also the problem of sample size. So any data set needs to be big enough to answer the question with sufficient confidence, or at least we need to show what that level of confidence is if the sample size that results from maybe not having a sample size that's big enough. And I've got a plot here, which is a result of some work with Peter Maskell, who's a forensic scientist up in Scotland. And this work looked at blood alcohol back calculations. So this is, someone is seen driving a car. Police suspect that they're drunk, take them into the station later on and get a measure of their blood alcohol level. But you need to work out what their blood alcohol was at the time they were driving. So you can do what's called a back calculation, which takes you from this point here at hour 2 back to this point here at hour 1. And the problem is the rate at which people's alcohol level in their blood is reduced, that differs between different individuals. And so you have to base this estimate of what the slope of this line is going to be on a data set. And that data set might not have many people in it, depending on the characteristics of the person. And so we can use the dark blue area to estimate what that blood alcohol level, what the uncertainty of it would be at time 0. But actually, because the data set is potentially quite small, we have to add on this additional little shaded bit of error, which is showing what the uncertainty is because of the size of the data set. And so, in some situations, let's say all of the blue is well above the limit, then you've got no problem, right? The small data set might be big enough to tell you what you want. But actually, in situations where that limit might fall in the light blue area, we have a problem, because if we take into account the size of the data, we've actually, it turns out, maybe not got enough to answer the question with the confidence we want. So that's an example of how sample size is important. And what statisticians can do is we can determine how many samples you need to answer a particular question. So I've got another brief example here on quality control for drug driving. And this is with my PhD student, Loliette. And she produced this nice graph where we were able to help SPA Forensic Services think about how many quality control samples they need to take to have confidence that their processes for drug driving tests are staying within control, essentially, keeping the uncertainty level in their results below a certain amount. Okay, so how long do I have left? About 5-10 minutes. Okay, so that's sample size and data. And my last point here is bias, which Jane has already talked about as well. It's how important it is to be aware of and avoid bias. And the Forensic Science Regulator has specific guidance on this. And there's a quote here, which I think is a good one. The consequences of cognitive bias may be far-reaching, and decisions by the investigator to follow a particular line of inquiry, blah, 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 frequently depends on the reliability of the evidence and the conclusions drawn from its interpretation. So they're saying we always need to be aware, investigators always need to be aware of this bias, because it may impact things later down the line and result in invalid and misleading statistical conclusions later on. And a good example here is Lucia de Burke, where that biased selection of the incidents by the investigators in the earlier case then caused problems with the statistics later on. Okay, so just to finish off, I've got a couple of slides on current activities that the Royal Statistical Society are involved in. And I'm asking the question, how can statisticians work with police, forensic scientists and the legal system to help resolve some of these issues around use of statistics? And as the committee, we've had lots of discussions on what we see the problems are and what we would like to fix. And there's a list here of some of, which is again not exhaustive, of some of the important things that we think should be resolved. So we would like to highlight that, as Jane said, statistical reasoning goes beyond p-values. So in the Letley case, it was said that the case had nothing to do with statistics, but in the court case, statistical assertions were made. They weren't numbers, but people talked about coincidence, it being unlikely, it being a significant rise. And those assertions were based on data, not necessarily in a traditional data set sense, but they were based on deaths and collapses. So inferences were being taken from data in court. So I think there's maybe a misunderstanding about what statistics is and what statistics can do, which we would like to help resolve. We'd also like to highlight that statistics is not common sense, which hopefully I've shown you with lots of examples, and requires input from statisticians. So statistical reasoning can go badly wrong and is not necessarily intuitive. We'd also like to encourage use of trained statisticians. So one of the problems we have as statisticians, I think, is that lots of other disciplines can have a little bit of training in statistics, like medics and forensic scientists, and therefore they then comment on statistics. But there's a line somewhere, because there will be cases where medics and forensic scientists perhaps can comment on some statistics, but where should we draw that line? When do you need a trained statistician? And how can we help non-statisticians tell when they do need a statistician? I don't think that's an obvious question. And then there's this point that Jane made as well about how do we support practitioners in finding statisticians and helping them assess whether a statistician is sufficiently qualified. And then the other thing we would like to do is to help provide guidance. So there's guidance already from the Forensic Science Regulator, FSR GUI 0004, and that's a start. But it's focused on forensic scientists. It doesn't cover all evidence types, and it doesn't cover all situations where statistics is used either. It's a lot about the interpretation of the statistics in that final stage in the court. And there are some existing resources that the Royal Statistical Society has been involved in. So I mentioned this already for one of my examples. There's a primer on statistics in legal proceedings that was managed by the Royal Society and the Royal Society of Edinburgh. There's an introduction to probability and statistics for advocates, which was done by Intercourt College of Advocacy and the Royal Statistical Society. There's links here. We're actually working on a new version of this, which we hope will be a bit more user-friendly. Then there's the fundamentals guides, which were led by Colin Aitken, who I've seen on this call somewhere. And here's the link to them. So there's 4 really useful guides on use of statistics in the law. And then there's the statistics for medical misconduct cases, which Jane was talking about, and the link to that is here. And then there's this Forensic Science Regulator guidance that I've already mentioned, which is linked here. There's other guidance like emphasis guidance on this as well. So there's some existing resources. And where else can you go for help? So you can try and speak to a statistician, but where do you find one? So universities are a good source of them. Many universities have statistical consultancy units or broad consultancy units that can help you put you in touch with the right person. And we would recommend using a Royal Statistical Society chartered statistician, because that kind of gives a minimum baseline. Many statisticians who could do the work might not be chartered statisticians, but at least you sort of have a minimum level there. And the RSS statistics in the law section can help put people in touch. And there are other relevant sections too. For example, there's a medical statistics section if you need specific expertise on medical statistics. And we have a website that's here, and you can join the mailing list of that. And you don't need to be an RSS member. And we don't send too many emails, but we run occasional events and things, and interdisciplinary events, which are usually free. So what are our current activities to try and resolve some of these questions and problems? So we're currently investigating how the Royal Statistical Society might be able to host a list of statisticians that could do expert witness work. There is an external consultants list on their website already, so we're kind of trying to work on something associated with that. We're currently writing guidance on statistics with the MPCC, and a lot of the things that I've talked about today are taken from that draft guidance, which is nearly finished. And it's not too long, so hopefully it'll be useful, and it contains a lot of the resources that I've mentioned and information about how to find statisticians. And as I said, we're also writing an update to the ICA guide to statistics, but that's a bit earlier on in the process. We've got plans for training for police with SPACE, and Jane and Rona Seymour also have one in the West Midlands, where we're hoping to develop a workshop to understand how we might help train police in statistics. We've run a course for advocates as well on statistics, and another one of those is planned for November down in London. We're also working with the Forensic Science Regulator to try and identify statistical gaps in policy. So some of our committee are on various advisory boards supporting the Forensic Science Regulator with statistics. For example, that guidance I've already mentioned, but also guidance on drug driving and drugs and toxicology more generally. We're also trying to encourage more statisticians to try expert witness work. So Jane was our first speaker in a seminar, as a seminar series we're running on that. And we're trying to provide some training and support for doing this. So we have young statisticians come along to the training courses we're running for advocates, so that they can also learn what it is like to be part of legal proceedings as an expert witness. And then, as Jane mentioned, we're also taking part in lots of running and taking part in lots of interdisciplinary activities, just like this one, where we hope to engage with police, lawyers, and forensic scientists. And so I'll finish there with the question of what else can we do to push things forward in this area. Thanks very much.
Thank you, Amy. Thanks very much. We've got just over 20 minutes, I think, to take some questions, and we've got quite a few comments and questions in both the chat, and there's a couple of things in the Q&A as well. So I'll just try and go through those. Thank you to those who identified the typo in Jane's talk, so she's acknowledged that. There's a question from David Ross about Scotland's rules on corroboration that might have meant this trial played out differently. I think this trial being the Letby case, possibly Jane, may have played out differently, as the expert opinion would not have been allowed the same weight. I don't know whether you've got a sense of whether there are different rules in different legal jurisdictions that give certain types of legal opinion greater or lesser weight.
Do you have a comment on that, Jane? The corroboration question.
I mean, certainly difference. I know there is a substantial difference between England and Scotland. I think in the individual case, you know, if you're talking individual cases, no, I think my main comment would be I would, you know, I don't know enough about the differences between them. I think all institutions can get things wrong, and every one of us individually can get things wrong. Yeah.
Okay, thank you very much. Helen Daly says she really enjoyed your talk, Jane. The vilification of paediatricians can work both ways. She was at Alderhay in '93 and glad there was no social media then. Yes, I think we all look back to those as halcyon days. Dr. Smith was heavily criticised until the statistical evidence proved the case. And her learning is getting statisticians involved is always a good idea. So I think that's just backing up what you both have already said. Nigel says, were the police up to investigating a case as complex as multiple neonatal deaths in Cheshire? Could it be that the hospital trust or doctors had a vested interest in there being a malicious explanation that meant they did not have to pay compensation? I suppose that's just something we can, I'm not sure that's a statistical question, but I guess there is a question there about the competence and skill set of police investigators in investigating very complex cases, which I think just backs up the point about getting a statistician involved so that you do have that evidence there. I don't know if you've got any thoughts about that question.
My default for any kind of healthcare setting is that it should go straight to whatever the current name is, you know, Health Protection Agency or so on, because, well, firstly, they've got the expertise. As I say, that is what they do. And secondly, if you find a cause, you don't then go and upset a lot of people by, you know, knocking on the door and saying you lost a baby, and by the way, we think the baby was murdered. If you've already found what the causes are. I mean, that's why I said, you know, good collaboration between Home Office and the police. My recommendation is that, yes, I mean, with complex cases, the police are required to refer to specialist units. I don't know how long that's been, but yeah, you know, that's why the plea for collaboration.
I do think there's a need perhaps for some sort of policing specific guidance on exactly what they should do in these situations, because it's tough. Police aren't statisticians, and what are they supposed to do in this situation? I think if there was firm policy and guidance there around that, I think that would help the situation a lot. About meaning who they should contact, you know, and in what order. Because I know that it can be difficult even if people do want to bring in a statistician, it can be difficult to do that because it's not clear where to get the statistician from.
Mhm.
And
exactly. So your guidance on that, Amy, is very welcome. There's a little bit of toing and froing between Jane and Helen on the Liverpool. I think that was the cystic fibrosis data. I don't know if there's anything else to add to that. Robert asks, wouldn't a tattoo convention give the perpetrator the perfect reason to commit the crime, minimizing the possibility of identification? In my experience as a criminologist, I'm not sure that offenders use that level of thinking prior to committing an act.
maybe it would depend on the crime. Yeah.
Quite possibly. I guess you'd have to think about the locus of the tattoo and all of these other things relating to the size of it and all of those other things as well. What I had a question about the tattoo, which is how do so in a case like that about a tattoo convention, where do statisticians get their information and evidence about population prevalence and you know exactly how many people have got that type of tattoo and where it is? So where do you find the evidence to form the basis of how unusual something actually is?
That's a great question. I don't know. I would search on. I would probably start with trying to search the literature for if there are any papers on tattoos. But it's very unlikely you would get a database of specific tattoos and how unusual there are. So there would need to be, I think, some sort of subjective judgment involved in that assessment of how unusual the tattoo is. But I think the important thing there is that is transparent, and that the reasoning for choosing a particular number. Sorry, go on, Jane.
Well, I mean, my thought actually was, I mean, partly tax records, you know, or some kind of commercial thing about tattoo parlors, you know, and just networking to find people who know about tattoo. So, you know, one of the things I enjoy about statistics is being given reasons to go and talk to lots of different people. But yeah, I mean, you know, that's, as I say, why you would want something multidisciplinary. And it's a kind of thing, if you're allowed to, it's quite fun to discuss in a common room or somewhere, or a pub, because actually you'll get ideas thrown in that you might not have come across. And you then have to, as Davey says, be transparent. And in some cases, of course, you have to say, we can't be certain. In fact, we can't get any clue at all. You know, that bit of evidence might not be able to be used.
Great, thank you. There's a little bit of discussion about whether statisticians are good at planning their crimes. I will not ask you to respond to that. There's a question here from, Lorna Dawson. How lovely to have Lorna on the line. I think this is probably for you, Amy, about the banknotes. Is the similar drugs on banknotes across the country a reflection of movement of all money? What about in places like Shetland?
Yeah, that's a great question. I will add actually that study's on paper money as well, so I have no idea if it still holds for polymer banknotes. But yes, essentially banknotes go back into sorting centres and then are sent to central places and all mixed up very quickly. So I think yes, it is a reflection of that. And about Shetland, I've no idea. I think we would need to check what happens to the money on Shetland. I think if there was a crime involving drugs on banknotes in Shetland, one would need to do a bit of extra work. We looked at, I can't remember exactly how many, 8 or 10 different locations around the UK, which did not include Shetland.
I would add, from my knowledge as a criminologist, that of course large, serious and organised crime gangs are now increasingly using crypto, so there'll be nothing to attach either cocaine or any other forms of identification to. So I guess that is a bit of a game changer. In your experience, do you know how often statisticians are called to court to give evidence, and for whom, either the prosecution or the defence? I guess that might be one for you, Jane, given their level of expertise.
No, it's not, because essentially I do civil, which means extremely rare. I have now done one criminal case in December after Letby, but yeah. Amy,
My
may know more.
my sense is that there's not that many actually, and sometimes that concerns me because a lot of forensic science evidence can actually be related to statistics. So I think statistics is being done and expert evidence is being given on statistics, but potentially that's being done by forensic scientists. There certainly is, there's some, but it's not hugely widespread. No.
Right. Okay.
Susan,
Robert.
I can see a patient hand raised.
Oh, there is a hand. You're right. Sorry. Is it Vimal? I'm not quite sure how to pronounce your name, but Vimal, do you want to come in and ask your question? Hello.
Yeah, hi. I thought I'd break the mold and kind of ask a question directly to the speakers. So first of all, thank you. Fascinating. I'm not a statistician. I'm not in the police. I'm a neonatologist. So I have been following a lot of stuff relating to Let Be and many of the other cases that you've referred to in your reference to Roy Meadows, and I'm also an expert witness. So I guess I could spend hours asking you questions actually, and apologise if I'm hijacking. But I suppose my first thought is, shouldn't it be routine where a case gets to court or is investigated that the court appoints, not for the defence, not for the prosecution, the court appoints an independent, appropriately qualified statistician to investigate clusters of deaths? That's question number one, or thoughts on that. And I guess the second is, what, as a medical expert, virtually all the papers that we look at to provide an opinion are based on statistics. And often, in the civil arena, it's on balance of probability. But that's often the extent of most expert witnesses' ability to interpret complex statistics. And often you get very high value negligence claims based on balance of probability stuff. And there are no statisticians involved. And I just wondered what your thoughts are, or whether there aren't enough statisticians to deal with all of this.
Do you want to take that one, Jane? I've got some answers too, but
I spent Monday, Tuesday, and Wednesday actually at conferences relating to this. The first was comparing with the USA. And yes, at the conference at Wednesday, I did rather mischievously, because nobody else was asking questions of the panel, ask when the legal profession which century they proposed to get in touch with modern science. Yeah, I mean, as the barristers would often say to me, most of them come from a non-numeric background. So their knee-jerk response is, let's get a doctor who'll very confidently give us an answer, rather than one of those statisticians who will ask us lots of difficult questions first and then give a nuanced answer. I'm old enough to have seen quite a lot of the development in the medical profession. And there is, as you know, a lot more statistics in there now. And I think we just have to continue. Amy's doing an excellent job. Continue to try to work with the courts. But yes, there are not enough statisticians. I think somebody raised the question about being frightened of being an expert witness. I don't watch television, but I think a lot of people get put off by very dramatic images and maybe don't realize that actually it's not that difficult, and also how much they've got to offer. They may think I've got nothing to offer, but actually they have. And with regard to doing anything for juries, I've just got slightly too much to do. I mean, one of our first discussions was the first media workshops. We did think about trying to put together a video explaining some of the basic statistical principles, a video intended for showing to juries. But again, there are not very many of us, so it hasn't happened.
We are actually thinking about some initiatives to work with expert witnesses, as in those that aren't statisticians, to try and get sort of basic probabilistic reasoning understood, and to bring in this message that there comes a point where you do need to get a statistician involved. So for me, I don't think that we as statisticians should be trying to teach other disciplines how to do statistics. I think we should be trying to teach them enough so that they know when they need to call a statistician. And that's what I'm trying to aim for with some of the work that I'm doing.
Thank you both. Are you happy with that, Vimal?
Yeah, thank you very much.
Thank you so much. Nigel's put his hand up, so we'll take your question and then I'll go back to the chat.
I've first got an observation on, so I did my first expert witness in November. It was a criminal case to do with electoral fraud. I was called to testify in Runcorn on the by-election, which is about half a day's travel away from me. The defence did a character assassination on me. They didn't refute my statistical testimony, but the judge threw my testimony out based on the character assassination. I would very happily do it again. It was incredibly stressful, so I will ask for some help trying to get more work. My question relates to the quality of data held by the police. My wife and I've spoken to Jane about this once. My wife and I have been investigated 12 times and no action has been taken against us. And in our case file, I've got 4 questionable data points. One is whether, so I was recorded as a suspect when the police failed to investigate and we took a civil action and the person who attacked me paid me compensation, but I'm still in the police files as the suspect. And then the people who've accused us, 2 of them are police employees. One of them is in a position that allows her to flag people as having special victim status. We don't know whether the other people who've made accusations against us repeatedly have been flagged as special victims. We have on occasions attempted to get help from the police and they've said we can't help you, only Inspector so-and-so can help you. So my question is partly about abuse of stuff by employees, and also how does anybody actually check the integrity of data, and if we then end up with AI policing, where does this leave us?
Okay, I'm going to encourage Jane or Amy to speak to the general rather than the specific, because I'm sure you appreciate, Nigel, that they can't comment on your specific case, but the general question about quality of data and how that is verified.
Certainly that's something that we discussed with the City of London Police when we did this Masters project, and I would hope that and the thing that Amy's talked about, the collaboration with the police service, will address the question of data quality. It's dear to most statisticians' hearts.
Yeah, it's a major problem. I think it is actually somewhat underappreciated as well. We sometimes have a habit of sort of taking data sets as they are without necessarily digging down into where the numbers have come from and how reliable they are. So I do think it's a really good point, and it's something that we are trying to deal with. There's been various discussions about pulling data sets into some sort of central repository within forensic science, but I don't know where that's got to.
Okay, thank you very much for your question, Nigel. I can see we've got another hand up, but we've got so many questions in the chat that I'm actually going to, I'm sorry, Gillian, I'm going to just kind of stick to the chat questions just to try and get through a few more of those. There's a question from David Ross about as an undergraduate, advising us never to appear as an expert witness. I wonder if other statistics lecturers give similar messages, and if there's a reluctance in the profession. Jane or Amy, I'm not sure if you have any views on that.
I think there can be, because I think people can be worried about it. I've heard that from people as well. I encourage my students to do it, so I'm the opposite. So, but there we are. Jane, I don't know if you've got any thoughts on that.
Well, my thoughts is that in medicine, as you got requirements from medical journals and research bodies, and of course the Committee on Safety of Medicine, as they started requiring statistical input and had statisticians evaluating the evidence, so your whole funding system changed, and we now have quite a lot in that. I think the difference would come in if, and it might be less expensive, of course, than having witnesses on both sides of a case, if more judges well, that's only for cases that go to court. But if cases went to court with a judge-appointed statistician who could list the problems, if those went into recorded judgments, that might well have a substantial impact on future cases.
Okay, thank you. I think Helen's commenting that the same is true for paediatricians avoiding giving evidence too. I'm going to just look for the really clear questions. Gillian asks, where could we find more information about the statistician as expert witness training, please? Tell you what we'll do, Gillian, we will collate that information and send it out to participants afterwards for you. In terms of Scottish law, Alan Patterson. Hello, Alan. In terms of Scottish law, Howden principle, Murov comes into play, which would allow stats to have weight. I'm not, again, that's a kind of specific point about Scottish law. I'm not sure whether either of you feel in a position to answer about that in terms of the weighting of statistics. Maybe not. Joanna says there's a detailed child death review process. Part of the problem with the Letby case was that the hospital completely ignored the child death review system. I think that's less of a question about statistics, but Jane is nodding her head. So I don't know if you want to say something about that, Jane.
Just that, I don't know, well, I can guess, but we don't know why neither the consultants nor the hospital authorities followed correct procedure.
Okay, thank you. David asks, is it ideal for statisticians as expert to appear in the court for witness? I mean, do you think that's the place where their role should be, or should it be more of a backroom role involved in the preparation of the case as a whole?
I think that they should be in the court when complicated things need explaining, because I just think it's unreasonable to expect people who aren't trained in statistics to defend statistics in a courtroom. I've come across this in forensic science applications where there's quite a lot of sort of fancy statistical techniques that we can use to analyze the evidence, but that forensic scientists can sometimes be reluctant to use those because they're worried about having to defend that in court. And so that's why we need the statisticians there to do it, because we could defend it in court. But then I've seen on the chat as well, Lorna's mentioned funding issues, and I think that's an important point as well in terms of funding for expert witnesses, because instead of having just one, you now need two, which obviously increase costs.
Exactly.
I certainly think also, I think statisticians can contribute in a lot of places. I mean, from my point of view, if statisticians can help make investigations more efficient, that in the end saves costs.
Exactly.
And collaboration on databases and so on.
Yeah. That's a very good point, Jane. A very good point to end on. In fact, I'm sorry I didn't get through all the questions. We have reached the end of the time. I'd just like to really thank Amy and Jane again for a fantastically interesting and thought-provoking presentation. Also thanking Isla Kerr and Monica Craig from the space team for organising and facilitating this event. And thanks to you all for joining. We'll make the recording available. And if anyone wants to follow up with either of our speakers, I'm sure they'd be happy to address any questions that you have that we didn't get round to answering today. So thank you very much, and we'll hopefully see you at further space events. Bye-bye.